Hi everyone, my name is Dr. Su and I'm one of the respiratory doctors who manages patients with motor neuron disease. This is a short video clip that we have created together with MND Society of Malaysia in order to help patients or caretakers with motor neuron disease to understand the condition a little bit better and how to cope with um, patients with respiratory symptoms. So the short video clip that I've created here is divided into two parts. The first part, we will explain a little bit on how the motor neuron disease affect your breathing and your respiratory system. The second part, we will give a little bit of explanation on non-invasive ventilation, or some call it as BPAP therapy. So a lot of times when patients with motor neuron disease or ALS, when they are referred to see a lung doctor or respiratory doctor, I get questions that come to me as to why a neurologist referred to see a lung doctor, whereby my symptoms are actually weaknesses of my hands and weaknesses of my legs, and my breathing is entirely fine. So the questions that always lies in the mind of our patients is, does MND or ALS actually affects the lungs and the breathing itself? So let's go to this simple diagram. This is a diagram that shows the muscles of the lung. So if you look at the diagram over here, for a normal person during normal quiet breathing, the principal muscles that involves or help in your breathing is involving the intercostal muscles, which is the muscles situated in between your ribs. And at the bottom of the lung, you have a big bulk of muscle which called the diaphragm. And this, together with the intercostal muscles, they work hand in hand to provide the respiratory pump, we call it, to help you to breathe in and also breathe out. And if you are doing some form of exercise, if you're out of breath, and when the principal muscles are tiring out, then the accessory muscles, that is some muscles at the neck, will actually help out in provide this breathing. So when a person has motor neuron disease, the muscles that are affected can also involve these respiratory muscles that I've mentioned earlier on to you. And that brings us to the question of hypoventilation. And this is fundamentally important to understand because patients with motor neuron disease or ALS, when their respiratory muscles are weak, they will develop hypoventilation. And when patients come to me, when they ask, what do you mean by hypoventilation? In a very simple manner, I will tell them it's explained by very shallow or very slow breathing. So imagine how does hypoventilation happen. Imagine when your muscles are weak and it starts off during sleep. So while a person is at sleep, there will be reduction in your awake state. That means your breathing is entirely dependent on the muscles that I've mentioned to you, especially your diaphragm and your intercostal muscles. And during sleep as well, there is loss of muscle tone. That means technically the body is at rest. So when the muscles are weak, it will be under strain to cope with the demands of the body. Thereby, you are unable to sustain an adequate ventilation. Therefore, there will be shallow or slow breathing, especially during sleep. So at the early phase, patients with motor neuron disease will experience hypoventilation during sleep. As the disease progresses, if there's no treatment being provided to them, then the hyperventilation state will also involve daytime. And at that stage, patient will experience symptoms like breathlessness. And so how do I know if I'm affected by hyperventilation? This is a common question that patients do ask. Some of the symptoms that we always advise patients to monitor themselves, do they really feel sleepy in the morning? Do they feel tired? Do they feel unfresh after even having 7 to 8 hours of sleep? And sometimes some of the patients may wake up feeling heaviness in their head, feeling headache. All those are symptoms that should be monitored. In fact, even having a very poor sleep quality is one of the early symptoms that suggests the patient may have hyperventilation. So apart from symptoms like I've mentioned, okay, when you are being referred to a respiratory doctors, we will carry out a series of tests to help to determine whether you will have some form of hypoventilation or whether you are at a higher risk of developing hypoventilation. This will involve a lung function test, we call it. That means a test to check the strength of your lung function and how strong you are able to blow through testing of your respiratory muscles. And on top of that, sometimes we will also would do a test to check the oxygen levels and the carbon dioxide levels through some blood tests. Through a combination of tests like the lung function or the respiratory muscle strength measurement, or perhaps the carbon dioxide levels in your blood, okay, and plus minus symptoms, we are able to formulate a diagnosis to inform you that whether you would have hypoventilation. So upon diagnosis, if you are concerned that you may have hypoventilation based on symptoms that I've mentioned earlier on, or you have been told by your neurologist or any other doctors to seek further advice or information, I would encourage you to get in contact with us through this email, mndmalaysia@gmail.com, so that they will arrange a suitable neurologist or suitable chest physician to assess you further. So as I mentioned earlier on, how is the test being tested? So upon coming to see a respiratory doctor, generally in the clinic, we will ask your history. We ask chronologically, how was the progression? How was the symptoms? After a history from you, we will carry out a quick examination to check your respiratory, your muscle strength of your limbs. We will also examine your lungs, and follow that, as I mentioned earlier on, we will carry out a lung function testing. Together with the lung function testing, we will also test your respiratory muscle strength in terms of how strong you are able to inhale and how strong you are able to exhale. There are some other tests to be carried out as well. For instance, like how strong you are able to cough and how well you are able to swallow, whereby this will be explained by doctors who are in charge on swallowing and clearing of secretion. Okay. So once patients come to us, and if any of these results suggest that the patient has hyperventilation? Is there any treatment for it? And what if treatment is not being provided? This is what if the patient chooses not for treatment for a time being. So the established treatment to help in hypoventilation is what we call non-invasive ventilation. So what actually is non-invasive ventilation? Is a assisted ventilation that is being provided to you non-invasively. That means it's through a mask, not through a tube. And at the early stage, it's only used at night during sleep. Some of the people actually call this as NIV, and some of the people use a normal term that you may heard of called a BPAP treatment. The treatment itself, I will explain further during part 2 of my talk. Thank you for your attention.